Hello everyone, this is Raven. She is my beautiful German Shepherd. She is 7 years old and she is the most perfect thing that has ever been. Now, the thing about being perfect though, is a little chilly, is you, that thing, nobody's gonna get through life without having some kind of musculoskeletal problems. So what today is going to be about is how to do some massage therapy for a dog, and in this case, the most common issue that dogs will face is hip arthritis, especially in these shepherd breeds. Now, when she was young, she was screened for hip dysplasia, which has to do with the hip joint not forming properly and being prone to a certain level of dislocation. There are other things that can occur in that the actual joint structure for dogs, the acetabulum, the cartilage structure that creates a larger socket for the ball part of the femur to insert into, that can kind of wear away. And these are issues that, we all deal with, all of us land-based mammals. Now, as a general rule, I'm not going to go through all of the anatomy of, specifically the dog. If you need to learn more about the anatomy of an animal that you are working with, or you just want to know more for the sake of curiosity, get some good resources, a book, watch some good videos on YouTube. There's a veterinary anatomy series that is just exceptional, where he does dissections and goes through all the muscles and bones and brings out bone models to reinforce the attachment sites of said muscles. Now, all vertebrates follow similar forms in terms of their skeleton. All vertebrates, from fish to human, have a skull, spinal cord, some ribs, and then you get some differences as you work your way up, as well as commonalities when you get into different groups. So all mammals, land-based mammals, you get to your marine mammals and they have some odd quirks about them. But as much fun as it sounds to massage a manatee, I am not planning on doing that. We will more commonly be dealing with dogs, if anything, when we work in massage. Some people specialize with equestrian animals or even bovine, cats, why not? But certain unique structures, she's being shy, she knows she's being under the lens, and she has already gone through a little bit of some therapy, so she might be feeling a little sad about, having her hip joint being worked on. So dogs, one of the unique things regarding their upper limb, real quick, is that the scapula is pretty free floating. They have just a vestigial collarbone or clavicle. The rule with clavicles in mammals is essentially, now there can be like smaller versions of it, etc., but the animal needs to be able to climb or fly to have a true fully formed clavicle that articulates at the sternum and out to the scapula. So if it can climb, it usually has a fully formed scapula. If it does not climb, if it's more built for running, then it usually does not have a clavicle that functions in the way that ours does. The rear limb, however, is quite similar. The biggest thing to take into consideration is just that they are all horizontal and we are vertical. So the shape of the pelvis is quite different, but the names of it, the ilium, the ischium, the pubis, all the structures are there. Just when you look at an animal's pelvis, it'll look like it's elongated and kind of flattened out, versus ours is more like a bowl and rounded. And that just has to do with we had to stand upright and we use it with the muscles to help stabilize our spine. And as far as the muscles are concerned, the muscles are almost all named essentially the same. Some are bigger in them than in us, like in dogs. When we get to the adductors, their gracilis muscle is quite a bit larger. If I were to compare the size of it in relation to the other muscles compared to how our gracilis relates to the other muscles, ours is a little bit thinner. Theirs is bigger. Their sartorius is bigger, but their glutes, although they have some density and mass to them, don't cover nearly as much space as ours. Part of why it's so important for humans to have strong glutes, because it is an essential aspect of being able to move around when you're standing vertical like we do. Our feet are also very strange and unique. Human feet. As far as the dog's body is concerned, and most other mammals, what they're walking on is really just their phalangeal joints, and the tarsal and carpal bones go up to a joint structure that doesn't use, so their carpal and tarsal bones don't make as much immediate contact with the ground. Gives them another space of distance that just makes them much better runners than us. So feet unique, etc. But the essentially number of vertebrae stays the same. Some mammals have different numbers of ribs, like a sloth is kind of a weird creature. But for the most part, even a giraffe, 7 cervical vertebrae, dog, 7 cervical vertebrae, ribs, so usually spine, ribs for the appendages, some kind of elephant ear shaped thing, a scapula, pelvis, same thing, long bone, humerus, femur, 2 small bones, radius, ulna, tibia, fibula, small bones, the carpals, the tarsals, and then the phalangeal bones. So it follows a very similar format, meaning also the muscles are essentially very similar. So the thing about them related to when I was talking about the glutes is glutes, yes, maybe cover less space, so they tend to be, all their animals tend to be a bit more hamstring dominant when going into hip extension or hyper extension. The glutes function in that, but they also assist in, since they're horizontal, they're helping support the hip joint in what's called elevation, whereas we may think of elevation in the human more related to the scapula, but again, since their spines are horizontal, all their limbs need some lift and support, so there's an elevation aspect with all of those. So slight differences in function for some structures just because of being horizontal versus vertical. But just like humans, most other animals, they don't get quite as much of the spine stuff as we do because of not stacking their spine, one vertebrae and disc on top of the other. But the hip and knee, in the dog, it does get called the stifle joint, and like the ankle joint gets called the hock. But to save mental energy, we're going to be calling it the hip, the knee, and the ankle joint. And just as she's laying, think that with humans, there's a fun condition out there called dormant butt syndrome, because we sit around too much with our hips and knees in flexion, and then we struggle to get out of that. Think about like a person standing up and having to use their own body to climb and get up. Getting into extension is the hard part, fighting gravity. So visualize, especially when you're assessing an animal, looking at when it's the most comfortable. Dog, typically with her, for example, she tends to kind of curl up, really get into a ball. she's a pretty big dog. She's about 90 pounds. So she's not a tiny thing. But she tries to curl up and make herself quite small. So hips very flexed. There's a rotational element. One hip underneath is going to have a different kind of being forced into some internal rotation. But with this, just like us, there's a tendency to get too dominant in flexion and a deduction, and internal rotation, maybe. It depends on kind of the animal, even just specific. I've seen, we fostered a shepherd that loved to lay on its back all splayed out, and I thought, well, that's probably a much better long-term strategy to staying like kind of stretched out and loose, versus this kind of tendency with her tending to always be like this, all curled up into flexion and adduction. It's no wonder that those muscles do begin to become hypertonic, especially with the inevitable onset of arthritis. So I am not a veterinarian. My dad was. My girlfriend is a guide dog mobility instructor. I have just enough knowledge to convince myself I know things, but like anything, if you have any concerns, then you should refer and consult a professional specialist immediately. With animals, seek out a veterinarian and make sure you screen things accordingly to make sure. She just recently had a checkup just a couple weeks ago, maybe closer to a month. The story with her onset. So I'm going to give a little bit of a history of her and what she's experiencing. And then in the next video, we'll look at just some of the strategies that I've already begun to use to help her. I thought it would be very good to document this process. One for myself, but I think a lot of people show interest in working with animals, particularly dogs. Maybe not that you're going to go and use these manual therapy concepts professionally, but even with your own pets, it can go a long way to just give you some strategies to help them sustain and be as healthy and comfortable for as long as possible. So it's wintertime now. I got sick and it's been very cold, and I usually keep her pretty active. We go and hit the trail just about, at least every other day, if not closer to every day. Do a few miles of hiking and running and all that good stuff. So she is conditioned to a pretty active lifestyle. And just like anything, it behooves all of us to take good care of our animals by making sure they get the exercise and movement that they need. These are some of the objective things that we can control. Making sure they get the appropriate amount of exercise. Managing their weight with good diet. As they get older, maybe changing their diet based on what we're seeing. How is their stool? How is their coat? All these can be good indicators of how healthy they are, and especially in response to the food they're taking in. So controllable variables, movement, and diet, just like us, right? Movement and diet goes a long way in preventing and managing a myriad of issues. So, but back to this onset. This was kind of always known to be an inevitability with her, with the hip arthritis. German shepherds, humans, with what we've done with specific breeds, it's a little bit brutal. So, shepherds in particular, if you go into the history of it, go back to the 30s, even the 20s, 30s, and 40s, much more streamlined, symmetrically structured, without that slope of their spine, and not such a broad rib cage in relation to their limbs. She's pretty horizontal compared to some, but is got a very big chesty thorax. So upper body just is in this breed, German Shepherd, is just so much more exaggerated in size. And so it's no wonder that they are especially prone to the hip arthritis, um, potentially knee issues as well. Other breeds you'll see, I've seen, bulldogs with ACL issues, all that kind of stuff. So hips, though, probably the most common thing that you will see that we can do an especially good job of helping manage, as long as we confirm, again, with a professional, make sure there's nothing serious going on. So if you're ever concerned or uncertain, make sure you screen any other potential variable, make sure it's musculoskeletal, and act accordingly. So I'm working my way through my story, right? She used to a pretty active lifestyle due to the holidays and then me getting sick. There was a stretch here, along with the colder weather, if I'm trying to put another variable in there, of her being in a more sedentary mode. And then suddenly there was this onset of her having some real bad issues with her right hip. We have some hardwood floors. Some sections and types of floor are slipperier than others. And that right hip just started, she was displaying a lot of pain signals. Very obvious ones. Limping, couple movements where there was a yelp. And so there had been other indicators, slow progressions of not being able to maybe jump as high. It's just, I had seen and knew that the hip stuff was coming one way or the other. But sure enough, with the activity cycle being disturbed, and this happens with anyone, it's not necessarily an acute injury that shifts everything in a particular direction and we get this domino effect of issues, but it can be just change in lifestyle. A few weeks of not following the movement program that we're used to, diet program that we're used to. That's a stressor on the system. So upon seeing that, I took the gamble and assumed the best and did a little bit of manual therapy and started playing with some changes that didn't take her out on the trail immediately. Started doing some play that secondarily functioned as exercise to get her to see if the response was if it all fit together. If I'm palpating and feeling things and the story all begins to make sense. Hip arthritis, something has exaggerated the underlying structural issue, and we're getting some muscle hypertonicity, maybe some mild muscle strain is something that I believe might have happened. And then seeing if by modulating the muscle tone, just equalizing it, agonist-antagonist relationships, it's the same across the board. And then after that, playing with some movement-based exercises to kind of re-strengthen things and help facilitate better balance and get her to, the classic one here is to get her to play more tug as opposed to just running. If we're just running forward in the sagittal plane as opposed to doing anything backward, all the movement science stuff that we think of for us, it applies to them. If they're conditioned to only doing one movement in one direction, we should think about strengthening the movements in the other directions. So frontal, sagittal plane, the transverse plane, all this stuff, right? So I wanted to see, did I get a response? So yesterday, I had done a fair amount of assessment, found tightness in the muscles that I expected to see that fit the same patterns I've seen with my clients. Sure enough, saw the exact same thing here with her. I have worked on her intermittently just to, as a maintenance thing. But have, to my own chagrin, not done as much manual therapy consistently as I'm realizing I should have been. So now it's going to become part of the routine. However, did some manual therapy and assessment, took her out, did some of these exercises that I'm talking about. I will do a future video of showing the actual exercises that I do with her. And sure enough, the response was pretty immediate. And then this morning in particular, it was substantial, at least 25% better. So to see that marked level of improvement with what was really not that much of an intervention, I mean, I am convinced at this stage that I am on the right track. So here we go. That's essentially the story. The next pieces are going to be me getting her into position and just showing what I've been doing. And hopefully it's an interesting thing to contemplate and learn from. Like anything, I just want to reinforce, do your due diligence in screening potentially more serious underlying conditions. Make sure if it's not your dog that the owner is present and in a position of helping control and keeping you safe. We misconstrue lots of stress behaviors in dogs. We over anthropomorphize things, and it would behoove any of us, if we're going to work with animals, to also learn something about animal and species specific behaviors. The two most common things that get misinterpreted with dogs is yawning and lip licking, both which are essentially stress behaviors. They can mean different things in different situations, but predominantly, especially if it's a new environment, a new person, some kind of tactile something going on for us, we need to be aware of the yawn and the lip licking as a sign, beyond everything else of flinching away from something, all of that. Owner being there, get to know the animal first. Safety first in all things. Also, it's their comfort. Make them feel like this is all a game and it's fun. Incorporating positive reinforcement is very important. Even just like when we cut her nails, if her nails are getting cut, I have treats right there. Same thing, lots of praise, whatever seems to put them at ease and make them happy the best. So praise, treats go a long way. High value treats, peanut butter, whatever their favorite is, etc. With that, like anything, be safe, not your dog. Think your way through. Have the owner there and follow all the safety protocols and processes that need be done, whether it even be having to have a muzzle. Not that that's something that I would want to have to do, but it's just like a veterinarian. Sometimes they need somebody, the owner, to be there to hold the dog in a position so they can do the examination or get the shot as safely as possible. So there. Now, she's a very, very good girl and looks a little bit always wounded and pathetic. So I promise I am not mean to this creature, but she will look like she is just the most pathetic thing all the time. But she is an exceptionally good girl. So how well she responds to me is not going to be indicative of what you're going to see. This isn't even me being a good trainer at all. I am just lucky that she is as spectacular as she is. So that's something to keep in mind, especially in comparing her to other shepherd breeds. She is a very emotionally sensitive, kind-spirited creature. So I'm especially lucky. And with that, she just, for better or worse, would do almost anything that I ask her to. So she's very compliant with everything. Okay, I'm going to chop this video so it doesn't last too long, and then we will return and we'll actually do the fun stuff. All right, there we go.